Have you ever wondered how does it feel like when a woman said she's having a painful experience after 2 or 3 days of episiotomy being given a kind of pain that some women describe as being painful than the actual labor pain. This is not good enough. A woman supposed to transit comfortably into a postpartum period in order to enjoy her motherhood period. So today I'm going to talk about tips needed for healing and comfort after episiotomy being given. Let's dive into this together. If you are watching me on TikTok, welcome to my page. What is episiotomy procedure itself? Episiotomy is a surgical incision that is given at the perineal area during birth in order to widen the birth space, the vaginal opening, to facilitate delivery. It is given at the posterior part of the vagina, at the area, the skin between the posterior vagina area and the anus. This is where episiotomy is being given, and it's not routinely given and is not widely used presently. But in some cases, there may be need to do this in order to facilitate birth at the second stage of labor if they observe or anticipate that there is likely to be delay in the second stage of labor. Number one thing in promoting healing and comfort after episiotomy is maintain good hygiene. Before using the toilet, before you pee, before you poo, make sure you wash the area with water, and before touching the area and the site of the episiotomy, make sure you wash your hand. It's very essential. Even after using the toilet, make sure you wash your area as well, because infection can actually cause or superimpose pain for a woman that have episiotomy, because infection will cause swelling of the area, which will make it painful. Another thing is to ensure that the place is clean and dry by changing your pad frequently when it's soiled, when it welts. Another thing to do within 24 hours of this procedure is to apply ice pack in order to reduce swelling because it's newly done. You didn't put the ice pack directly to the suture area. You can wrap the ice pack in a clean cloth to apply it to the area to reduce swelling and promote comfort. This will actually help. Other things to do to, to manage pain safely during postpartum period when episiotomy is being given is avoid straining during bowel movements. Is avoid straining when you are defecating, because this will cause strain on the stitches area, and this tends to be very painful. Eat high fiber foods, fruits and vegetables, whole grain, and drink plenty of water regularly in order to prevent straining during the time you are defecating. Another thing to maintain comfort after episiotomy is rest. Rest supports your body on a soft pillow. Sit down on a soft pillow. You can make it in a form of donut, cushion. Sit down on a cushion area. Make a donut to relieve pressure You can try to lie on your side when resting or feeding your baby. It may not be easy to sit down when you have suture, but you can make a soft pillow or a soft cloth and make it in form of a donut mm, for you to sit on it to relieve pressure on the stitches area. Sitz baths is another good practice and it's commonly used after delivery in postpartum period. Just get Sitz baths bowl container. You can get this from online and put lukewarm water inside the container. Uh, don't use hot water because hot water can remove the stitches, which will enable the incision or the cut area to just open up, and this attracts infection. So sit on that lukewarm water that you added a salt inside it, and this will relieve you of pain and promote comfort. This is important. Another thing is to take your analgesic that you are being given in the hospital to relieve pain. This is essential. This will enable you to cope very well postpartumly. And don't forget to watch out for signs of infection, like when the pain continue after 1, 2, 3 days and you cannot even cope with it, despite the fact you are taking analgesic. When you observe foul smelling discharge from the area, or when you are having fever, high temperature during the postpartum period, report to your healthcare provider. This is essential. I've come to the end of this video. If you have stayed with me to this end, thank you for staying with me till the end. As a pregnant woman, expectant mother, watching me right now, I wish you safe delivery, healthy babies to healthy family. Bye for now.